Hello, my name is Jaleesa Copeland, and I am from Waycross, Georgia, which is a small town in South Georgia where there were not a lot of jobs. Due to that, that kind of caused me to want to do a job that paid the most, which led me to healthcare. And with that being said, I do pretty much everything in healthcare. I'm a CNA, I am a therapist, and I am a healthcare case manager, and I'm also a high school healthcare science teacher so that I can hit all sectors of healthcare. For someone who does not know what CNA means, it means a certified nursing assistant. So that's basically when you have taken in class lecture and also have done skills in class as well as going into the field and doing a certain amount of clinical hours. And once you have done all of that, you're able to sit and test on a state level with written tests, which you'll be answering questions on how to care for a patient and then actually physically showing how to care for a patient so that you can take care of people in a healthcare setting without being supervised. So a typical day looks like for me during the school year, I'm working with my high school students who are interested in the healthcare field, just kind of helping them build those foundational skills, just to make sure they truly want to be in healthcare, whether that's clinical or administrative, or even mental health. So just helping them explore all those opportunities as well as preparing for life after high school, for as what things they need to do in order to get into the healthcare field of their chosen career. And then after work, I start talking to my clients that I case management for, who are ICWP clients who have TBI and are physically disabled. So I help them and their caregivers kind of navigate the healthcare world for them so they can stay within their home and be a part of the community but be safe as well. So that's a typical day for me. So my favorite part about being a CNA is just having that hands-on relationship with your patient. You and the LPN or RN are going to be the closest to the patient outside of their families, but you guys end up becoming a family with the patient because you'll be with them so much. So the CNA is probably typically the one who sees the patient first and who may spend the most time with the patient. So that's probably my favorite part, just really learning the patient and their family. Some things that families don't realize CNAs do every day is how much we are hands on for is not only the clinical aspect of making sure the loved one is comfortable, but also the mental. So we can always sense a lot of times if our patient has something off with them, even if it's not physical, and just trying to adjust our care to basically how the patient is feeling because we want to make sure they're doing good physically and mentally. The way that I would build trust with a new client is just getting to know that client outside of their diagnosis and their clinical issues that they may have, and just getting to know who they are as a person, and then also sharing who I am, and us just having common interests that we could talk about and relate on. So that could be something like as small as a TV show, our favorite place to eat, and just doing different outings together as well if possible. Maintaining someone's dignity to me is just being sure that they have autonomy over their health care. So, not me deciding what we do and how we do it, but just giving them different options and letting them choose those options and letting them know that they are in control of their health care, not the healthcare provider. How did I help my clients maintain their independence for as a CNA and also as a healthcare case manager? It's just making sure that they are still doing things that they like. So I do not control their day to day at all. I kind of go with what they want to do on the day to day and try to make sure they have assistance so they can still live their normal lives based on how they decide, unless it's something that could possibly put them in danger. Ooh, some things that I have learned is that just being sure that you have stuff in place so that you can live comfortably as you get older. Another thing that I have learned is that the people that you take care of when you're at your best typically turn around and take care of you. So just be sure you pour as much as you can into your family and your children because they are going to be the ones who may have to take care of you in the end. And it just makes it a way more better situation when you have your loved ones around you because you loved on them when it was your chance to. Some signs that a family caregiver may need if they need additional support, and I feel like everybody needs additional support, is when you start to feel overwhelmed or you're having anxiety about coming home, or even your loved one getting on your nerves by doing little things that they normally do every day. And then also, you just having a hard time juggling your day to day life and caring for a loved one. But I don't think anybody should care for a loved one alone. Thing I wish families knew about caregiving is a lot of people just think it's clinical, but it's so much that goes on behind the scenes. So you have to be sure you're partnered with somebody who kind of knows how to get things paid for. So you really could benefit from a healthcare case manager like me, so that we can navigate all the insurance policies and just making sure your loved one gets the care that they need without you having to come out of pocket. We can make sure insurance pays for it and we can find them the best providers to bring the best care. So, a moment that reminded me of why I became a CNA or a healthcare case manager is one of my clients. She ended up basically coding when she was having a baby due to her blood pressure being too high. And they were able to revive her. So she is a mom of three. So she was living with her family and just, not mentally doing well. And when you're not mentally doing well, your physical declines as well. So just being able to help her get the resources so that she can get her own place and house her kids in a comfortable environment, and just seeing how much the family has started thriving since they have moved on their own and their life has just basically transformed and she's getting better and she's becoming more independent. That is one thing, and in one scenario that reminded me of why I became a healthcare case manager. Just seeing how people start and just seeing their outcome once I've provided them a service to change their day to day life. Advice I would give someone who is thinking about becoming a CNA is just know that this is your starting point. It was a starting point for me, and it really helps you kind of identify what part of healthcare you want to be in, which the CNA let me know that I don't want to be so hands on clinically. I like the administrative and the mental health and the social aspect of healthcare, but CNA is a great place to start so you can see exactly where you want to be before you commit a lot of time and education into your chosen profession.